moving to how can we become more efficient? How can we maximize our work cost efficiency? And the model that I like to use here is lean. We may have heard of that from lean manufacturing, Toyota and other companies. To boil it down, I think really the one sentence summary of it is how do we turn a 5-step process into a 3-step process? Because it's really how do we drive up quality and how do we drive down cost, which is exactly what we're trying to do in the future for the healthcare system. And so if I take a 5-step process and I eliminate 2 steps, I've improved quality because I've taken out 2 steps where an error can occur, where a defect can occur. I've also decreased cost because I've removed 2 steps of work. So by streamlining that process, taking it from 5 steps to 3 steps, I'm now saving money and I'm improving quality. So that's the mindset that we want to try to have as we look at the processes within our practice. It's also important to look at what is the customer value, what's important to the patient. Because at the end of the day, if it's not important to the patient, or it's not important to the patient or payer, or perhaps a partner like the hospital, why are we doing it? Maybe valid reasons. The government says we have to, okay, regulatory reasons. But you really want to understand, if it's taken me a bunch of extra work to generate this result and the patient only cares about the result, they don't care what happens behind the curtain. They don't care about all the work that I'm having to do and all the triple backflips that my staff is having to do. So if I can streamline that and just focus our time and effort to what the patient values most, those are the things that help drive, where do we prioritize our time and effort. One of the key focus areas of the whole lean concept is where can we identify and eliminate waste. And anytime there's waiting, that's considered a waste, particularly for the physician. So anytime that the physician is waiting on lab results, waiting on staff, waiting on the patient, that's downtime. If you're the most important asset in your practice, the physician, you're the one that generates the revenue, that provides the high-value patient services. So we want to eliminate waiting as much as possible for the physician. But it's also important for the patient. When we're looking at patient satisfaction, patients generally don't like to wait. They say, my time is valuable, and if I'm sitting in the waiting room for an hour, if that can be avoided, that's valuable to me. So anything that we can do to reduce or eliminate waiting, duplication of services, non-value-added services, all those things are important to drive up value and to help us become more efficient and effective. Continuous improvement. This is a philosophy that really is a underlying concept of the whole lean manufacturing, and it's all about how can we continuously improve. We don't reach the pinnacle of, we're there, we can put our feet up on the table, we're as good as we're going to get. It's how do we continuously improve? And the staff has to be actively engaged in that. It's not about the physicians sitting in their office or lying in bed awake at night trying to think brilliant thoughts of how do I make my practice better. Oftentimes it's the staff, it's your front desk staff coming up with a better way that we can collect more co-pays, or that we can try to prevent no-shows, whatever it might be. Your clinical staff, how do we better adhere to some of these clinical pathways? But really making sure that they're involved and always thinking, how can we continually improve, how can we add value? Stabilize and standardize process, version control. So we don't want Susie doing it one way, Betty doing it another way, and Ethel doing it a third way. And that's a real challenge. When I have gone into practices, a lot of it comes down to tribal knowledge. Well, this is the way we've always done it, and this is the way I trained to do it, but that person left and somebody else is doing it a third way. We want to identify what's the best practice, try to adhere to that for the staff, as well as for the clinical protocols that we're following, but really try to identify what are opportunities for decreasing variation through standardization. Getting to the root cause. So in Lean, Toyota Production System, they have what they call the 5 whys. And it's all about, I ask why 5 times to try to make sure I really understand what's the cause of a problem. So, why does this happen? Why did it happen? And you just keep asking that until you're confident you really come to what's the root cause, so that we're not treating the symptom, but we're treating the underlying cause. The whole point about building in quality, making sure that we have a staff that's a high-performance staff, that they understand the importance of building in the quality rather than having somebody try to inspect it at the end. Leveling the workload. Oftentimes in practices we have our very busy times. If we can identify that and level the workload, so in an ideal world, so from an assembly line in a lean manufacturing company, they want a steady flow. Ideally in our medical practice, that's what we like to get to. We would like to avoid these big peak periods where we have to rush and all the patients come in at once and the staff is stressed and I'm stressed and I'm way behind and all that type of stuff. If we can figure out what are the causes, what are some things that we can do to accommodate those so that our schedule is more of an even flow, that's valuable and that helps improve quality. Economies of scale and scope. Here again, that's when you have a small and a mid-sized practice, some of the costs you really can't afford on your own. And so a good example is a payer contracting specialist. And this is one where you get economies of scale if you can utilize, a payer contracting specialist, such as from, PPN. So now that level of expertise, I can't afford to hire a payer contracting specialist within my practice. However, if I can utilize, one that is part of PPN, now I get access to that resource, but I'm only paying for, in a sense, the fraction that I'm using rather than having to pay for the whole thing. The economies of scope are, can we develop specialized expertise? So having somebody that does, payer contracting full-time, really knows the payers well, knows their metrics, they're going to be better at that than somebody that's trying to do it amongst, multitasking all the other activities the office manager, practice manager, or the physician needs to do. Are there like services that we can put together into clinics, patient conditions and so forth to decrease that downtime? So again, in a manufacturing setting, if I have to set up my machine and it's down because we have to change it to produce the next widget, that's no value add. And so from a manufacturing standpoint, we try to decrease the downtime. It's the same thing for the practice. If we have these certain chronic patients that are difficult and take a lot of resources and really slows down the practice or stops the practice, what are the things that we can do? Is it grouping them together so that we're seeing all of these diabetic patients together, or all of these more complex patients together when we have more resources? These are things that we can look at to say, how can we better manage their care? Ensure your compensation models facilitate productivity and desired outcomes. So the whole point here is, again, we want to make sure there's alignment with our staff with what are the goals that we're trying to achieve. And it doesn't have to be that you're paying them big bonuses. It can be as simple as gas cards or McDonald's gift certificates. Maybe it's a staff lunch. Maybe it's a pat on the back. I just want to announce that Susie really did a great job this month. She got 95% of eligible copays that she was able to capture. Great job, Susie. Not only does she feel good, but it really starts setting that high performance standard that you hope the rest of the staff aspires to. So trying to put some of these things that you're really creating that culture that you need and that you're incentivizing that. What you don't want to do is disincentivize it. So your highest producer, you just keep feeding her all this work. She's very productive, so we just keep feeding her all the work because she's good at it. Well, she's going to figure out pretty soon, maybe I don't want to work as hard. Maybe I don't want to be productive because all they do is they keep dumping on me. So, keep those types of things in mind in how you structure the work and how you plan out, making sure that there's alignment and incentives that are accomplishing what we want to.